All right. Hi, everyone. We apologize for our 9-minute delay. We just had some volume challenges. We couldn't hear each other, so we figured it out, and here we are. And I already see that a bunch of you are on, so again, appreciate your patience. So welcome to tonight's fertility sessions, where you get expert advice from women's health experts. Tonight, our topic is all about PCOS. Specifically, do you have it and how it can affect your pregnancy? For those of you who don't know who I am, I'm Aimee Raupp. I'm a women's health and wellness expert. I'm an acupuncturist and author. I wrote, my most recent book is this one, Yes, You Can Get Pregnant. Natural Ways to Improve Your Fertility Now and into Your 40s. And I deal in my clinics all day long with women who are trying to get pregnant. And there's a lot of them that have PCOS. And so I've learned a lot about PCOS over the years. And even if they're not trying to get pregnant, just how to manage it so that they can either get pregnant when they want to or just generally feel better and more hormonally balanced. And tonight, I'm so excited to have the PCOS Diva with us. I will let Aimee do her own introduction. So here you go, Aimee.
Well, thanks for having me. And yes, thanks for everyone for being so patient. So I'm Aimee Medling. I'm a certified health coach. I'm the founder of PCOS Diva. And PCOSdiva.com is a website dedicated to helping women manage the symptoms of PCOS and to really learn how to thrive with PCOS. And my mission statement is to help women reclaim their fertility, femininity, health, and happiness, because it really takes this holistic lifestyle approach, I believe, to manage PCOS. And I'm also a woman who is thriving with PCOS. And I'm really happy to share what I know with you all tonight.
Love it. Wonderful. Sounds great. And so, Aimee, when did you have PCOS? How did you figure it all out for yourself?
Yeah, so I think a lot of women listening could probably relate a bit with my story. PCOS typically starts kind of showing itself in puberty. So I think I knew at like age 14 that something was not quite right. But it wasn't until I was 31 until I was actually diagnosed. So it's a very, very typical. I think I'm hopeful that things are starting to shift. But all through my teen years, I struggled with acne, and I was, always a thin girl. My early teens was very thin, but towards, my late teens, early 20s, I started to gain weight at a rapid rate, and it couldn't really attribute it to anything with my lifestyle at the time. I also started losing my hair and growing hair where I didn't want it, and I remember visiting a dermatologist, and she said, "Oh, it's just the stress of senior year in high school and preparing for college." So I would get these like little excuses. Oh, it's just stress, or you're exercising too much, because I did not get my cycles on a regular basis, and I was an athlete. So oh, you're just over exercising, and they'll come back when you're not playing so many sports. So it wasn't until I was suffering with I wouldn't even say suffering, but really dealing with secondary infertility, trying to get pregnant with my second child. And that's when I was diagnosed. And it was really through something that I want to talk about, ovulation tracking and tracking my cycle. And once I really became empowered and understood what my body was doing and wasn't doing, it really put me in a place of control to really demand some answers. And then that's when I got them. So that was probably one of my first steps of being a diva.
I love it. That's wonderful. So, so then you went on to rectify PCOS and had your second child?
Yeah, so, and again, I think a lot of women can relate. You know, you go to the doctors, you do the ultrasound, you see that classic
Yeah.
strand of pearls on the ultrasound, and you know, you're now diagnosed with PCOS, and doctors typically will give you a prescription for metformin and Clomid for you know, ovulation inducing, and kind of send you on your merry way. And that's exactly what happened to me. And boy, I could not tolerate metformin, and I tried the extended release version, and it just, I thought there's no way that I can live like this and not know when I'm gonna, you know, have to run to the bathroom. You know, whether it's, I remember being at a Christmas party and throwing up in the bathroom because I had something really fatty, that just, metformin just didn't work for me. So long story short, once I did get pregnant, and I did after about 5 cycles of Clomid, and being on metformin, and you know, now I have this baby and a 3-year-old, and thought, you know, that I cannot live my life this way. I'm way too young to feel so old. You know, now at age 32, you know, what am I going to do? And so that's when I just kind of started researching. There, at the time, there were some really wonderful books out. Dr. Samuel Thatcher had a medical book for PCOS, and he also had a patient's kind of version. I, you know, read anything I could get my hands on. And then I started writing actually for the PCOS Association, and had access to some of the really top docs at the time to interview them. And that just sort of led me on this journey of discovery and learning how to manage my PCOS through lifestyle change. It took a lot of trial and error and experimentation, and I just started sharing what I was learning on a tiny little blog. It's actually still out there somewhere. It was a little WordPress blog, and I started getting followers, and it was really kind of thrilling that I could help others as I was helping myself. And that kind of was how this all began.
That's so great. I love it. It's a great story. It's a great story.
Yeah.
Yes, I see a lot of women with PCOS in the clinic, and then there's a lot that are not diagnosed, right, until they become a client of mine, or like, you know, what you went through, lots of hormonal imbalance, maybe trying to get pregnant, not succeeding at it, or just wanting to regulate their cycles and realizing that there's an ovulation disorder, which, for those of you that don't know, the most common cause of, you know, we don't use the I word in my world, infertility, we don't use that. So the most common cause of fertility challenges is ovulation disorders, which are typically related to PCOS. So whether you're here because you are trying to conceive, or just really to manage your hormones or anything like that, I think to both of us, it doesn't quite matter. We really just want you to feel better and be more hormonally balanced. And so tonight's all about us trying to help you figure out ways to shift your lifestyle and manage your PCOS. So before we let's break it down. So Aimee, want to tell us, I mean, because I know there's 2 different types basically, right? There's like the insulin resistant type, and then there's the non-insulin resistant type. So right, they call them the thick and the thin PCOS types, right? Which I think is, I don't really like those designations, if you will, but that women present very differently. You know, both have the same type of ovulation disorder, but that the presentations are quite different. So you want to break down some of the symptoms there, or the signs of PCOS?
Yeah, and I think that's one of the reasons why it's hard for some women to get a diagnosis, because they don't present themselves as the classic PCOS. Now, I did have the classic PCOS. I had anovulation, and you're right, Aimee, 75% of anovulatory fertility challenges
Thank you.
because of PCOS. And PCOS, 50% of women are undiagnosed that have PCOS, and up to 20% of all women have it. So the sort of the classic type is somebody who has insulin resistance, which I definitely did. I had irregular periods, and I had high androgens, but I was not, my BMI wasn't way out of whack. So I think that's when you're saying sort of that thin sister or thin PCOS, it can be sort of deceiving because, you know, a lot of women do struggle with weight issues. And I did have the classic polycystic ovaries, but you do not have to have those polycystic, you know, a lot of women with PCOS don't have those cysts on their ovaries. And actually the National Institute of Health, or I'm trying to think who I guess it was the NIH, they're sort of trying to change the name of PCOS to something maybe more metabolic related, because sort of a misnomer, because not all women have it. So, and there's some people that, you know, might have the missing cycles and don't deal with androgens. So PCOS is really unique to every woman. And, you know, that the treatment that, that you prescribe almost, you know, really needs to be unique to every woman. And I know there's this really fantastic women's health advocate. You probably know her, Aimee, Sonia Savay of Hormone Soup. And
Yes.
yeah, and she is starting this whole initiative of precision healthcare for PCOS. So really treating each woman from, you know, her own sort of bio individuality. So, you know, that's something that's definitely coming, you know, down the road, and that's really exciting. But so just to kind of back up, if you think that, you know, if you're having anovulatory cycles and that is sort of qualified as 10 cycles a year, or cycles that last more than 35 days, and you have issues like I was experiencing, hair loss, and it's kind of, you know, can be sort of a diffuse hair loss. You have hair growth where, you know, you don't really necessarily want it, you know, facial hair, chest, you know, inner thigh, that kind of thing. And you have insulin resistance, sort of that classic sort of mid-tire, you know, that's kind of a classic apple shape is typically insulin resistance. You know, hypothyroidism is also connected with PCOS. You know, irritability and moodiness and depression and anxiety. You know, there's just a whole myriad of symptoms. But you know, you want to talk to your doctor about getting a diagnosis. And the way that doctors sort of should be diagnosing is based on the Rotterdam criteria. You know, it's not perfect, and I think as we get to understand these different phenotypes, we can get more precise in the diagnostics. But right now, you would present 2 out of 3 of the following symptoms. So you would have the polycystic ovaries, you'd have the high androgens, and you'd have the irregular cycles, or the anovulatory cycles. So that's how you would get a PCOS diagnosis.
And what about, so for androgens, you're talking about testosterone and sexual hormone binding globulin, right?
The DHEA.
Oh, okay, DHEA. So what about, often I see too in the clinic when the ratio of FSH to LH is a 1-to-1, that's another indicator, correct?
Yeah, so LH can be higher, and not all women have that issue. Right. And so something, just a little tip out there, I know I see a lot of women saying, you know, should I be taking Vitex or chaste tree extract? And, you know, you really need to get your LH tested, because Vitex actually can elevate that more. So, you know, a lot of women, it works great for, but there's a lot of, like myself, you know, I had elevated LH, and chaste tree did nothing for me, and it probably made things worse. So, you know, before you jump out and start sort of self-medicating, you know, it's important that you get the hormone panel and understand what these supplements do, because they're very powerful, and we can talk about some of them tonight. And some of these supplements have outperformed metformin. So it's nothing to really fool around with, and you want to kind of be as educated as you can be.
Yeah, and just to chime in there, I am an herbalist and a Chinese herbalist, and we use Vitex or chaseberry in our repertoire, but we never individually prescribe herbs because we like to create a custom formula for the patient's presentation. And so it's very individualized treatment. So often I'll have girls and they come to me and they're taking Vitex just because they read somewhere that they should, and it helps with ovulation or progesterone. They don't even know what it really helps with. And I usually say it's not something I recommend. You can continue if you want, but I prefer that you back off, and we'll either put you on an herbal regulating formula or just go without it and see what happens. But I just recently had a PCOS case, and she was taking Vitex, and her cycles were actually getting longer. And it disrupted like all of a sudden she started having 60-day cycles when I was actually regulating her and getting her back to 30-day cycles with a clear ovulation. And then she saw another practitioner who encouraged Vitex, and it totally threw off her cycle. We got her off of it, and this past month she actually fell pregnant, which is amazing. So it finally worked, But so, do you want to get into the Vitex thing, or we'll let that unfold as?
Yeah, let's let that unfold. I think I think the point that I really want to make is that PCOS is a syndrome. It's not a disease. Doesn't present itself the same with any two women. And the other thing too is things change as you age. I'm maybe a lot of it is due to lifestyle, but my androgens are certainly not as high as they were in my early 20s. My cycles are very regular, and women with PCOS, as they age, their cycles do tend to become more regular. Their androgens, reduce. And I think, the good news is that women, and we can talk about this a little bit more, women with PCOS seem to remain fertile longer. And that's really good news. And I think that, there's a lot of sort of scary things that we might talk about. Certainly there are some risk factors, when, you are PCOS and have a pregnancy. But I just really want to kind of frame this whole talk from a place of hope, because women with PCOS can get pregnant. Really most of the time. It might take a little longer, and I just want to encourage you to, like Aimee said, shift your thinking to fertility challenged rather than infertile. And cannot tell you how many women have come to me and said, doctors told me I could never have a child. And they took that as truth. And, now they're in their 50s, and they really missed an opportunity, I think, where, they possibly could have gotten pregnant. So know that the, I think the luck's on your side. I was told at 18 in my college clinic that I would probably never get pregnant, and if I did, they would have to jump through some huge hoops. Now, can you imagine saying that to an 18-year-old freshman?
Terrible.
But I just, honestly, I never thought that was my story. My mom, I knew, had fertility challenges, and she got pregnant and had two girls. And I just thought, what, when the time comes, I'll figure this out. And I really want you to think that way too. When the time comes, and listen, you're on this podcast right now, or this Google Hangout, figuring it out. And I encourage you to just continue to be a diva and, keep pushing and keep educating yourself. So there's a lot of good news here, and I'm excited to kind of dive in with you.
Yeah, I love it. So, I second everything Aimee says. If you follow me at all or know anything about my teachings, it's all about empowering you, and that you have the power to shift your health and improve your fertility. So one thing I always find too in the clinic when a woman comes in with PCOS, I usually say, oh, we got that, that you'll get pregnant. I've never not had a PCOS girl not get pregnant. They always do. It's typically just figuring out and regulating the cycle enough, and then allowing for what I call an efficient ovulation to happen, rather than sometimes there's an attempt and then an attempt, and to just get that one full swoop and then sex at the right time and it can happen. But let's get into the lifestyle shifts that we should make to manage PCOS. And I'll let the diva lead on that, and I'll chime in.
So I think that, before, so many women just sort of rush into the getting pregnant part, and they really need to take some time to prepare their bodies. And, I love, Aimee, your sort of vision of this, and maybe you can talk about your vision of, yes, go.
Well, yeah, that's huge. I mean, I always say, your fertility is an extension of your health. So my goal really is to get you as healthy as you can possibly be. And then I want you to get pregnant, because that means then you're going to have a healthy pregnancy and deliver a healthy child and bring that healthy child into a healthy home. So that's my whole vision. But in Chinese medicine, there's this beautiful vision of the uterus is what we call the child's palace. The translation of uterus actually in Chinese is child's palace. And so to start to look at, and the uterus in Chinese medicine is all encompassing the fallopian tubes, the ovaries, the cervix, the vagina, the entire reproductive area is considered the uterus. So this is all palatial. And again, the health of that area is an extension of your overall health. So, so going on what Aimee said, a lot of women just want to flip the switch and be pregnant, versus understanding the nature of their body and getting themselves as healthy as they possibly can be, and really revamping that palace and changing the internal environment of their body. To think about it this way, it's like you're growing a human inside your body. So everything that you interact with, everything that you come in contact with affects the health of that child. It sincerely does. It gets into your bloodstream. You share that bloodstream with them. So I want you to be as healthy as you can be prior. So there's the preconception period, which I think is incredibly important. And then when we are pregnant, typically in Chinese medicine too, we see, or I shouldn't even say Chinese medicine, just in what I see in the clinic, if a woman follows that pattern of the metformin, the Clomid, that whole situation, I'm very much generalizing here, but there's often a miscarriage. There's I shouldn't say often, but there are miscarriages there, and I am very convinced that it's because the quality of those eggs were not the egg that the Clomid kind of forced you to ovulate was not ideal. It wasn't so the child didn't sustain itself. The life didn't sustain itself, and so there was a miscarriage. And that, if you've been through a miscarriage, my heart goes out to you. It's the most traumatizing thing in the world, and talk about losing some faith in your body. And so when I have a situation like that come up, my goal is to really, get the woman off the metformin, or at least work with her while she's on it, but give herself a couple months. The process of folliculogenesis, when you're generating that follicle that you will ovulate and then will become a child, takes about 100 days. So that's, all the lifestyle shifts that we're going to talk about. I really strongly recommend that you follow those for 100 days before you go and try to get pregnant, if you're in the throes of PCOS. If you're already doing some of this and it's all starting to work, but we really want to see all of, what I call the kinks in the system starting to work themselves out. And then that is a reflection to me that the health of your palace, including those eggs that you're going to ovulate. And as PCOS girls, you have plenty of eggs, so we're not worried about an ovarian count here, but quality does become a concern. So really, I recommend at least a 3-month plan where you're following what we're talking about tonight, and then going back into trying to conceive. And I know for some women that's very challenging because they have a time frame, but I would say, you know, be patient, surrender to the process. And one thing I always say too to women who are concerned about age, which, you know, that comes into play. You know, I got pregnant naturally at 40 by following all this information, but B, I believe that making these lifestyle shifts actually fights the aging process. And so you actually cellularly become younger as you continue to live this lifestyle plan. And it's not just something I've created in my head. There's actually science behind to support this. And we're seeing that, you know, there's a lot of the fertility clinics out there that now that are recommending certain diet changes and certain supplements and antioxidants because they're seeing that embryo or even egg quality is improving by following these regimens. So with all that said, let's get into some of the main lifestyle shifts that you would recommend, Aim.
So you're right. You got to prepare your child's home, and you did mention the miscarriage rate. You know, miscarriage with metformin, and you know, it is something that is a reality. So women with PCOS are at a higher risk of miscarriage, and the metabolic issues, the insulin resistance, really needs to be addressed before you get pregnant, because if you don't, that actually increases miscarriage rate up to, I know Dr. Mark Perlow, who's really fantastic PCOS fertility doc down in Atlanta, he says it's as high as 60%. So,
wow.
And metabolic issues, they affect egg quality, implantation, placental development. So we've got to get the insulin resistance in check. And we also have to, you know, PCOS science is showing that women with PCOS are in this chronic state of inflammation, this low-level inflammation. So we have to live this anti-inflammatory kind of lifestyle. And that's really what the Diva lifestyle is. And I think it really starts with your diet. And, you know, a lot of women say their doctor tells them, you know, gives them the prescription, tells them to lose some weight, go on a low carb diet and get to the gym.
Right.
Well, you know, it's so much deeper than that. And I really encourage you to start viewing your produce section as your pharmacy. I mean, you have to be feeding yourself lots of anti-inflammatory produce and, you know, and clean animal meats. Like, you remember, you're preparing this temple. So, you know, my approach is just this, you know, lots of whole foods. And, you know, I mean, the amount of vegetables that I probably eat in one day, you know, you got to think like pounds. You know, greens. You can put greens in your breakfast, like to try to get as much veg in your day. You know, smoothies with greens or eggs with greens, or even have a little salad, and then, you know, more for lunch. The more fresh produce that brings down the inflammation in your body, and then really avoiding anti-inflammatory foods. So I think for most women with PCOS, that's gluten. And even for some women, they have to really be careful with grains in general. You know, again, we're all bio individuals, and PCOS is different for everyone. I think women with really, you know, lots of insulin resistance should probably stay away from the grains. We need healthy fats. Do not be afraid of fats. We need, you know, avocado and nuts and grass-fed butter. You know, grass-fed butter is
the best
fantastic.
thing in the world.
I know my son just makes butter sandwiches with slabs of butter, but he's 16 and 178 pounds and needs to, and 6'8" and needs to put on weight. But don't be afraid. Fat is not going to make you fat. And you need it. And the omega 3s are crucial for reducing inflammation. They help reduce androgen. They help with the insulin resistance. So, you know, I really encourage women to take plenty of omega 3s and make sure there's, you know, adequate DHA in there as well. You know, flaxseed is not going to cut it for women with PCOS. We can't really convert the omega 3s in, vegetarian sources of omega-3s into DHA and EPA, which we need. So, healthy fats are really important. And then please buy the cleanest meat that you can afford. Grass-fed, organic beef, organic chicken, wild fish. I can't tell you how many women eat tilapia and think they're doing their body a favor. Please do not eat tilapia. It's really filled with unhealthy, omega-6 fats. Wild salmon, wild cod, all of those things are really fantastic. And I think it's really hard for a woman with PCOS to be vegan. So I'm just going to put that out there. I haven't really met a woman with PCOS that is successfully managing it on a vegan diet.
Can I chime in? I haven't met a woman who's trying to get pregnant that successfully does it on a vegan diet, or that has a healthy pregnancy. And I could get major backlash for saying that, but it's true. I always joke that any vegetarians or vegan that enter my clinic wind up becoming, carnivores. The very least that I get them to take liver in pill form, and they'll do butter and eggs. But couldn't agree with Aimee more. And that's one thing I see with especially with the insulin resistant types, that they need loads and loads of protein and fat, and of course vegetables, and then little to no grains. And what I would recommend, and so if you're not sure if that's you or how your body's going to respond, is to do a 2-week experiment and cut grains out entirely. Or for sure, if you're still eating gluten, cut gluten out first. See how you feel. Because all of this is, I do the same thing with any of my clients, and my coaching is, what are the kinks in your system? So to find that, and if you're having these PCOS symptoms or weight gain, gastrointestinal issues, anxiety, depression, acne, any of those types of red flags or kinks in your system, then, I'm sure Aimee agrees, we would encourage you to make some of these lifestyle shifts. So if you haven't already cut out gluten, I would cut it out for sure. Do two solid weeks, ideally a month, ideally forever, but just start there and see the changes in your system. Increase your omega-3s from fish. I like cod liver oil as well. I recommend like a teaspoon a day, of cod liver oil. Great source of omegas for balancing hormones. But to make these shifts and to actually see that they're going to work. And the other thing that's really important in all this is that gauge how you feel. If you're starting to feel better, that's the key. That's what we want to see. Not if you got the positive, ovulation predictor kit. I mean, that's going to come, but see how you feel. That is the most important thing. I want you to feel better. Aimee wants you to feel better. That's what we want. And these changes sometimes take a couple months for you to see the full effects in the world of if you're trying to get pregnant or the full regulation of your period. But start to gauge your symptoms and see how you're feeling. That's just so incredibly important. And then you go ahead.
I was just going to add dairy on there. That A1 casein is really highly inflammatory for most people. I find, and that's a protein in, most dairy cows. I mean, there's, one variety that doesn't have that protein. But, in general, dairy, really wreaks havoc on women with PCOS and their hormones. So try that for, like Aimee said, 3 weeks, and see how you feel. And I can probably, it's hard because a lot of people are addicted to cheese, but you really need, if this is part of your goal, is to start feeling better and to regain your fertility, then you have to make that choice. And all of these choices are going to be really important when you do get pregnant, because women with PCOS have a higher risk of gestational diabetes. And that's nothing to fool around with. So if you're already eating well, preparing your temple, and you're used to this lifestyle, then you're going to sail through pregnancy and avoid gestational diabetes. So, making sure that you have protein with every meal, and, don't let your blood sugar dip, have a protein, carb, fat snack 2-3 times a day. So that's really important. And exercise after a meal, that will help bring your insulin resistance down. And you need to prioritize sleep. I don't know, Aimee, if you see this with your clients.
Yeah, it's mandatory.
Yeah, you need to be in bed by 10. That's what I tell my clients, to try to sort of reset those circadian rhythms. If you can be in bed by 10 and try to get yourself up by 6. I think for most people, that's will kind of work for you. If you have a hard time relaxing before bed, have some magnesium. That I think a lot of us are, especially women with PCOS, I think the statistic is we're 19 times more likely to have magnesium deficiency.
Wow.
Yeah, and most of us have magnesium deficiencies, but take some magnesium. I take a chelated magnesium malate, but it doesn't really cause those GI issues if magnesium bothers you. And then stress is very inflammatory, and it's really kind of wreaks havoc on your insulin as well. So we've got to learn how to manage stress, and we can talk about that too if you want some specifics.
Yeah, get into some specifics. Go ahead.
Yeah, so I've just discovered a really great little gadget. It's called a Spire, S-P-I-R-E.
Oh, I don't know. Okay.
Yeah, and you wear it like right in your bra, like right in the middle where your cleavage is. And it kind of monitors your breathing. And it's amazing. So if I'm at my computer and I'm, typing off something, and I start shallow breathing, it'll send a little cue to my iPhone saying, I think you need to take some deep breaths, or are you getting this? Yes. And it's crazy because it really is making me so much more mindful of my breathing, which, really helps with that kind of parasympathetic nervous system. And your there's a wonderful article on my site that we just put out along with the announcement about this webinar about your vagus nerve from Dr. Shauna Daru, and read that because breathing is going to help you with your PCOS, and she does a brilliant job explaining. And then I think another great little gadget I've used is the heart math monitor, and so that sort of syncs your breathing with your heart rate, and it's really cool because it gives you sort of a tangible output. You have this little node that you attach to your earlobe, and it hooks right into your iPhone, and you can breathe and sync it with your heart rate, and that will calm you down as well. I mean, I'm a real believer in sort of using your breath because it's free. You don't have to really do anything. It's easy. You can do it anywhere. And just do some breath work. And I'm sure, Aimee, you have some exercises that you must do with your clients.
Yeah, I of course am a proponent of meditation, but I think that can be a little overwhelming to some people. So I just call it chill out and check in time, where you just take chill out breaks throughout the day. You can set a reminder on your phone, and we're just talking 2, 3, 4, 5 minutes, not a lot of time, but same thing as what Aimee's saying is just breathing. That's it. Just taking a deep breath in, and I do counts of 4. So you breathe in for 4, hold for 4, and then exhale for 4. And if you can do that for a solid 5 minutes, it will completely break that stress cycle. So you're typically in it, and then you can break it back down, and then you might fall back into it. Another thing some of my clients do is like reminders on their phone. All those gadgets are great now. A Post-it, if you're sitting at a desk all day, that just says breathe, But one of the things that is so important to me and that I try to teach everyone is, body literacy. So just being aware, that if you're at your desk and you're on a deadline or something like that, like, are your shoulders like this? Is your jaw clenched? Are you not breathing? Are you shallowly breathing? Is your heart racing? That type of thing. So to just notice when you feel that and then shift it, catch yourself there. But yeah, stress is so important, and I see it, you know, often with PCOS girls who are trying to get pregnant, and they start to get really stressed about it, that actually some of their symptoms come back, which is fascinating to me because they're on the diet, they're, you know, they're following the protocol, if you will, and stress alone is what's causing a flare up of their symptoms, like, you
Yeah.
know, increased facial hair, or, you know, delayed ovulation. It's so, and that's hard. You know, I wish I could just wave a magic wand and make all the stress go away. But to, you know, to just remember that even if you're breaking that stress cycle just a couple times a day, it will make a major difference in the regulation of your hormones, and in the insulin resistance for sure. And then, Aim, let's get into some of the endocrine disrupting chemicals in our lifestyle and our like bath and beauty products, because that's huge, especially, I mean, for all women, and especially once you are pregnant, but because everything that you put on your skin gets into your bloodstream and can affect your child. But for sure, all the chemicals in our bath and beauty and household cleaning products can really disrupt your hormones. And so it's not just a diet overhaul that's required. It's literally a lifestyle overhaul. And so I don't know if you want to talk a little bit about that.
Yeah, so I think that's so, you know, really step number one is dealing with the metabolic issues. Step number two is detoxification. And I just don't think that enough, you know, doctors, endocrinologists, you know, nobody's really talking about the importance of detoxification. And women with PCOS have higher levels of non-alcoholic fatty liver syndrome. You know, they have these compromised livers, and your liver is what detoxifies all of these toxins. And so, you know, it's really a two-step approach. You need to learn, you need to do something to help your body detoxify better. And, you know, yes, you know, I understand that your body was made to detoxify itself, and, you know, you shouldn't really have to do these detoxification programs. But you know what? Women with PCOS have been shown in study after study to have higher levels of things like BPA, bisphenol A, and phthalates, and PFOAs and PCBs and pesticides. I mean, you can go on PubMed and see all of these things.
Crazy.
And so, you know, you wonder, are the rates of PCOS going up because of, you know, the toxins that we're exposed to? You know, there's 80,000 toxins that are sort of approved in the U.S. and you know, in use, and, you know, thousands of new toxins are introduced every year. So, I mean, we're just, and that, and there's some studies that have shown that, you know, the toxins are sort of a generational, I don't know, for lack of a better word, sin. You know, something that my grandmother used may have sort of upset my hormonal balance,
yeah, totally.
2 generations later. So, you know, you're not, as you're preparing your body for pregnancy, you're not only sort of helping your immediate children, but maybe your great-grandchildren. So it's just really important to, you know, help your body detoxify. So you can do that by getting rid of the junk, you know, anything that has artificial chemicals, coloring, you know, the packaged goods with stuff that you can't even read the names, you know, get it out, really eat as whole as you can. And that's the other reason to get rid of the you know, non-organic meats, because that, you know, anything that has fat or protein, you know, it's has more toxins in it. So buy clean fat and clean protein. And then you really need to help your liver, and there's supplements that can do that. So things like milk thistle and N-acetylcysteine, which is really a fantastic supplement for women with PCOS because it helps on so many different levels. So it helps kind of produce the glutathione, which is kind of the master antioxidant. And, you know, it will make your, ovaries function better. It helps with insulin resistance. It helps your liver process toxins. It helps reduce testosterone. So, it's just one of these really fantastic supplements that can help on different levels. But so I recommend my clients with PCOS do a cleanse twice a year, 2 to 3 times a year. It's something that I do in the spring and fall. And, maybe after the holidays, if you feel like, you've indulged a little too much and need a reset. I know a lot of women ask, say that, I'm having a really hard time losing weight. Well, you know what? Those toxins that have built up in your fat and your system need to be released, and often doing a detoxification program. And the one that I use it's kind of like a functional food-based cleanse. So it's 2 shakes. They're an organic pea protein, but they have all of those nutrients to support the phase 1 and phase 2 of liver detoxification. So, you do a cleanse, you kind of get those toxins out, you take out the foods that are sort of compromising your system, like the gluten and the dairy and grains. But then you have to avoid retox. And so that's when we have to really look at our environment and what we're bringing into our houses, because our houses are actually more toxic than the outside environment. Because think about all of the cleaners that we have, all of those scented candles and, that we're lighting, and our mattresses are toxic, and the carpeting. But, we can't, you can kind of call it like detoxorexia, where you're just so obsessed about the toxins, and you can get kind of crazy about it. But I think there's some really easy things that you can do. So, BPA can kind of be cleared from your, studies have shown that being cleared from your system fairly quickly, unlike some other toxins. So just really being careful of the plastics that you're using. Really, I recommend you ditching all the plastic Tupperware, just to get rid of it all and start using like glass Pyrex or stainless steel. Certainly, getting like a clean canteen or something to use your water, or, you see I'm drinking my water from just a glass. So, really watching the plastics that you're using, really try to get rid of them. That will cut the BPA exposure tremendously. And then looking at your makeup and your beauty care, parabens are an endocrine disruptor, and phthalates are an endocrine disruptor. So, I'm a big proponent of Morocco method hair care. It's done wonders to my hair. I suffered with a lot of PCOS related hair loss, and it's actually, thickened my hair up to what it was sort of when I was, in my early teens before PCOS. But that is like a raw product. You could probably eat it if you really wanted to. You look at the label, you can pronounce everything. There's no, weird chemicals in it. And then, your facial products, and you want to, like, your skin is porous. A lot of those particles can go right into your bloodstream. So you want to really be careful what you're putting on your skin.
I couldn't agree more.
Yeah.
What I say is, if you can't eat it, you shouldn't put it on your skin. That's my general rule of thumb. And after writing my first book, Chill Out and Get Healthy, was when I really realized how toxic all of our bath and beauty products are. I had to do all this research, and I have lists in both my books of what to avoid, but I went on this hunt to try to find really good, I have very sensitive skin, and what would work for me, and I couldn't find anything and that was right for my skin type and basically edible. So I created my own skincare line, and that's you probably don't know I have a skincare line, but I do. I mean, it's very basic. I have like 3 different facial oils, a cleanser, I have a sugar scrub, a toner. It's growing. It continues to grow, but I launched it in full probably about 2 years ago. And But literally you can eat every single product if you wanted to. And we did a promo video for one of them, and I ate some of my sugar scrub. And I don't really ever eat sugar, but it's so important. The bath and beauty products and the household cleaning, if you don't shift those, and in the back of my book, Yes, You Can Get Pregnant, I have what I call Aimee approved products, and even how to make your own cleaning products. I mean, it's so easy. I just use apple cider vinegar, and then we use baking soda to clean. I mean, it's very basic. It's very easy. Yeah, and then getting rid of plastics altogether. Everything's glass. One of the doctors I interviewed for Yes, You Can Get Pregnant, I was talking to him about the prevalence of autoimmune illnesses and all these chemicals, and one of his areas of research was BPA and its effects not just on fertility in women, trying to conceive, but long-term effects on their children because of their exposure. So similar to what you said, Aimee, about like what your grandmother was exposed to could have actually shifted your genes, right? And then your lifestyle shifted them on, so not enough time to get into it tonight, but the whole field of epigenetics, that our genes aren't really set in stone, that we have these predispositions, and then how we live our life kind of allows them to express themselves or not. So but these exposures are real, and 80,000 chemicals, like Aimee said. I'm doing a lot of research on autoimmune diseases right now, and it's interesting that, and there's some question that PCOS can fall into this autoimmune category, or definitely women with PCOS can, there's some with autoimmune diseases, but that over the last 30 years, the incidence of autoimmune diseases has tripled, and it has to be environmental. All the scientists support the fact that it's all these chemicals in our environment. So these are actually causing real deal major diseases and illnesses. So you have to take it very seriously. And then when you are pregnant, you need to take it seriously. And then when you have that child, I make all of my son's products. I'm a bit crazy. I make everything from his wipes, and it's pretty easy. I have a full-time job and 3 businesses basically, and I can do it. So I know you guys can too, but we need to take it very seriously. Even his mattress is organic that he sleeps on, the whole thing. But I want to make sure, I want to get to some of the questions, if that's okay, because I don't want to miss these. So we've addressed some of them already. One was asking about secondary infertility with PCOS. Is there hope for conception? And I think we can agree that for sure there's hope. Absolutely there's hope. Don't you dare give up hope. And let's see. Ovarian drilling. Do you know much about ovarian drilling, Aimee?
Yeah, so actually my mother had ovarian wedge recession back in 1970. And it boggles my mind that, this doctor, she grew up in, central Massachusetts. It wasn't even down in Boston. Did this wedge recession. And then I was born, pretty much like 12 months later. So basically it's kind of a Band-Aid fix. So they used to take a wedge out of your ovary, and it would reduce the androgens for a while. And then, your body sort of compensates and it sort of goes back to normal. But now they do drilling. So they're sort of drilling into the ovary, sort of reducing the surface area, kind of like a wedge recession. But I was at ASRM, it's the American Society of Reproductive Medicine. They have a big conference every fall. And I was there this past fall and attended, all of the PCOS talks. And they talked about ovarian drilling being really second line fertility treatments, that they really, and I wanted to bring this up because I don't think a lot of women understand that there's an alternative to Clomid that actually has performed better, and that's called letrozole. And so, letrozole, I wrote down some facts here if I could find, because I don't have it all on the top of my head. so letrozole had a 44% higher rate of live birth than Clomid without a difference in side effects. And, you know, a really
Say that
solid,
again, how many?
a 44% higher rate of live birth than Clomid. And that, and there really isn't any difference in side effects. So this really top PCOS researcher, his name's Richard LeGros, he did all of this research, and I have a really great article about it on my site. So you can, has all of the references, print it out, just do a search for Clomid on PCOS Diva and you'll find it. Print it out and bring it to your doctor, because chances are they might not know about letrozole either. And, you know, show them the science and, you know, advocate for that. So before you do ovarian drilling, you know, which there's, I think, more risks than trying letrozole. And then the other thing too, there's some really great supplements out there, like combination inositols. So the product that I use is Avasitol, and like N-acetylcysteine, it helps, and fish oil. It helps on so many different levels. But I think that is something that is all natural. You know, it costs $78 on my site for a 3-month supply. And a lot of women, you know, get pregnant just after using the Avasitol. So, you know, we can talk a little bit more about how that all works, but I wanted to just make sure we can get to some of the other questions. I have tons of information about inositols on my site.
Yeah, so I love inositols as well. Liver does have it naturally occurring, which I find fascinating as well. And it's a great antioxidant for just even generally improving egg quality, right? So is the one that you have on your site, is it just all myo-inositol, or is there anything else in there?
Avasitol is in sort of that 40-to-1 ratio, which is kind of that ideal ratio, you know, in our bodies. It's sort of the theory that they're going on. So it's 4 grams of myo-inositol to 100 milligrams of the D-chiro-inositol.
Okay.
And you know, it's been shown to help improve insulin sensitivity and reduce androgen. It increases ovulation. It normalizes progesterone. It has outperformed, this is the one that's outperformed metformin in terms of weight reduction, spontaneous ovulation, and pregnancy. So, you know, without all of those nasty metformin side effects, and this is an important point I want to make. If you are on metformin, you must be supplementing with methylcobalamin B12, because and doctors don't tell you that. And there was just a study that came out just a couple weeks ago that the incidences of like neuropathies and neural problems as a result of metformin because of B12 deficiency is, you know, kind of out there as a factor. So you don't want to end up having that problem when all you had to do is to, you know, supplement with some methylated B12. And, you know, I just want to kind of go back to my points for kind of preparing for pregnancy. You know, we have the controlling our insulin resistance, the detoxification, but then I want you to get some tests. So I really want you to have your thyroid tested, and not just TSH. Do not take no for an answer. You know, ask for a complete thyroid panel, ask for thyroid antibodies. That's that will indicate whether you have an autoimmune condition called Hashimoto's, which a lot of women with PCOS do. And there can be some complications with pregnancy, you know, increased miscarriage if you have undiagnosed hypothyroidism. So get that checked. The other thing that you need to be checked for is the MTHFR mutation. Yeah, I'll tell you, you know what, it kills me because my husband has a heart condition, and we went to we're outside of Boston, one of the top Leahy clinics. He's like the top heart guy for this particular condition. I said, my husband has MTHFR, which is a genetic mutation, and you don't methylate. That's one of the issues. You don't methylate B vitamins like folate or folic acid into folate. He had no idea what that meant. So yeah, you have to advocate for yourself. And if you have MTHFR, it can cause blood clotting disorders and it can cause miscarriage. And you can, it's something that can be sort of treated if you know about it. And you should not be taking prenatals with folic acid. They need to have L-methylfolate. So, I have a great prenatal that I offer, and there's plenty of other prenatals out there that have, folate. So if your prenatal says folic acid, please throw it in the trash. Do yourself a favor. So those are, two other things that I think are really important in preparing yourself for pregnancy with PCOS.
Yeah, and I think even in general, what I tend to do now is just put everyone on a methylfolate, to be honest, because it can't hurt anything. And the clotting factor disorders are very serious, and they're more likely in the MTHFR girls. But basically, if you have a clotting factor disorder, you will have recurring miscarriages until the clotting factor disorder is rectified. And sometimes it can be as simple as taking something like methylfolate on a regular basis. And then also to keep in mind too that too much folic acid, so in that prenatal is not only can you not absorb it, but it can actually be toxic to your system. So yeah, I personally didn't even take a prenatal in my pregnancy. I don't know. Well, you didn't get all this education until after your pregnancy, so you probably did. But I took cod liver oil every day, liver pills. So it's basically the equivalent of like 4 ounces of liver a week is what I took in pill form. Spirulina, blue-green algae. I took a methylfolate, probiotic. And am I missing anything? I think that's all I took. Yeah, and then a lot of obviously good healthy fats in my diet and tons of vegetables and things like bone broth too. We didn't really talk much about, but I'm sure you're a fan of broth as well. But yeah, the thyroid is super important as well. And also to keep in mind too, if you do come back with those antibodies and you do have Hashimoto's, then it's absolutely imperative that you go gluten and dairy free, because every time you have gluten and dairy, it kicks back up those antibodies again. And those antibodies basically attack the thyroid and compromise its function. And so if that's happening and you're pregnant, that could also lead to complications in your pregnancy, complications in your life and trying to get pregnant, all of the above. So I'm with Aimee. Those are standard. I'm most of the time the person who finds a thyroid disorder in the patient. And they've been to 3 different fertility doctors at that point. They've been to endocrinologists. I'm typically the one, yes, who finds the PCOS as well. And it's I mean, I'm so grateful that you and I can do this for so many women, right? That's a wonderful blessing and a service that we provide. But it's very frustrating too that you've seen, doctors and then some of you have been told like they're, secondary infertility, there's probably no chance you're going to get pregnant again, or, all sorts of gloom and doom. And to just realize that there's so many things that you can do and can shift in your life to really manage this PCOS and improve your health so that you can feel better, and then you can get pregnant when you want to and have a healthy pregnancy without gestational diabetes, which would be really nice, and then also give birth to a beautiful, healthy child that you bring into a healthy home that is free of chemicals. All very important. So I was looking through the questions, and basically we covered everything. So what I'll say to all of you is, if there's a burning question that I might have overlooked that you didn't hear, then just email me and I'll recap it. But I think we covered all of the questions. So Aimee, do you want to just kind of go over those steps again, for...
Yeah. So like my PCOS Diva protocol, and I have a program called Jumpstart that really introduces you to this lifestyle. So, you want to look at these different areas of your life. So you certainly want to look at diet. We talked about diet and exercise. We didn't really touch upon exercise, but women preparing to get pregnant, trying to get pregnant need to really be doing strength training. I don't want you to be doing like preparing for like a half marathon, sort of that single exertion exercise where you're jogging for 12 miles is not helpful for PCOS. You want high intensity interval training. So, doing some weight, some burst activity. I really love Pure Barre, and doing some, jumping on my rebounder, doing some of that high intensity interval training. Yoga has been shown to be really helpful for women with PCOS. Sometimes if you're really killing yourself at the gym, you're raising that inflammation and it's not helpful. So you got to be careful about exercise. We talked about mindset. Having that positive mindset is so important. Making sure you have plenty of sleep, making sure that you're managing your stress to the best of your ability, and detoxifying. And then I just wanted to add creativity and getting in touch with your creativity. I think women with PCOS who are really suffering have lost a sense of sort of that creative flow. And if you think about your ovaries, they're the point of creation. And you need to get in touch with what makes you sort of come alive, and go back to what you enjoyed doing as a kid. Maybe it was dancing, maybe it was even just going out and ride your bike, or paint, or write in a journal. Something to get in touch with that creative flow is really important in this whole process.
I love that.
And then mindfulness, we talked about getting into your body, getting out of your head and into your body, and understanding how these things make your body feel is just such a critical piece of the whole equation. And then getting in the kitchen. You can't be afraid of getting in the kitchen and cooking real food from scratch. So important. I have lots of meal plans with great recipes, but you got to get very comfortable in the kitchen. That's super important. So that's sort of like the PCOS Diva lifestyle, in a nutshell. But we're preparing for pregnancy. We talked about managing the inflammation with an anti-inflammatory lifestyle, reducing insulin, increasing your insulin sensitivity, detoxifying, getting some testing done. And I also failed to mention vitamin D. Women with PCOS tend to be super vitamin D deficient. So your vitamin D should be checked. It's linked, low vitamin D is linked to hypertension, which is another risk factor for PCOS pregnancy. And you really need to, it also helps with inflammation. So get it checked. You might be at such low levels that you need like mega doses to get optimized. So I don't want to really give a dose. You want to see what you're at, and then you kind of dose from there. And then B12, we talked about it with the metformin, but women with PCOS tend to be really low in B12, and that's kind of like a fertility nutrient. You need,
so important.
Yeah, you need B12. So, that is really important. See what else. Oh, and then the hopeful thing is that women with PCOS have better egg reserve into our later years. And you kind of mentioned at the beginning, Aimee, that we got plenty of eggs. And actually, there's a study out of Sweden that suggests that women with PCOS may begin life with more eggs than women without PCOS. So as we age, we have more eggs remaining. And that is good news. The other thing that I just wanted to mention, and I'm sure you use, being a Chinese medicine practitioner, you are probably familiar with peony, white peony root.
Love it.
And licorice. Kind of that combo is a really powerful combo.
I use it all the time.
Yeah, it's really powerful for women with PCOS. It's peony is actually a strong anti-androgen, but it also really stimulates, the ovary and, you know, it kind of helps produce estrogen rather than testosterone. So, you know, I really like peony, although you don't hear about it much because it's never been trialed. You know, it's women like you know, practitioners like you, Aimee, that know that it's like this really fantastic sort of secret.
Yeah.
And, you know, I want to let the cat out of the bag because it needs to, more women need to use, you know, even try the peony and licorice before they try Clomid and, you know, letrozole.
All I would say is try to get it from an actual herbalist so that they can prescribe it appropriately.
Yeah, don't buy it online. Don't buy it, you know, supplement.
Don't buy like a random thing on Amazon or something because you don't even know if it's actually what it says it is or the potency. So I would recommend doing a consult with an herbalist, you know, like myself or someone out there that you may know, and getting on a formula that's individualized just for you. But I do love the peony and licorice combination. It's my mentor. It's one of her favorite combinations. And so I use it quite a bit. They're two amazing herbs. And so we did get one question that I think we should address where, well, it was a comment that this is all overwhelming. Where do I start? And I totally get that. And, you know, we talk about it so loosely and easily because it is our lifestyle and we've been doing it for quite some time. And we obviously see the dramatic changes in ourselves and in our clients. So, you know, to us, it's a no-brainer. But I think, and Aimee, you can chime in too, but I think I would recommend, like I said in the beginning, give yourself like a trial period. Do maybe 2 weeks or a month following a diet where you eliminate gluten, eliminate packaged foods. So just go back to basics. Eat, you know, organic vegetables and produce, healthy fats like coconut oil, ghee or butter, all organic. Coconut oil is great when it's cold pressed and extra virgin, unrefined. Ghee is basically clarified butter, so the dairy is cooked out of it. It's not, you can't really call it dairy free, but if you have a dairy allergy, you shouldn't have it. And then grass-fed butter, animal protein that is pastured or grass-fed, always organic. Think of things like eggs and, you know, chicken, and then tons of seafood, again, like what Aimee was talking about. And, you know, I'm sure Aimee has plans on her site that could be easy to follow. You could also pick up my book, Yes, You Can Get Pregnant. There's a diet plan laid out in there. You know, there's a 7-day plan on how to do this. And I would start there. And then that way you see the changes and you start to feel encouraged. And then you will want to continue. You know, I've basically never pulled foods from someone's diet and they see changes that then they go back, you know. And I always joke too, you know, if I go, and sometimes I do indulge and have a slice of pizza or something like that, and I call it, it's like I get a gluten hangover from it, you know, but I know, and I sign up for it and I say, okay, like it's worth it. I'm going to do it. I'm going to enjoy every bite of it, you know, but I would say that is less than, you know, 2% of my life, you know, that these shifts, you'll make them and you'll start to see how you feel better, and then you'll just continue to make more of them. It will get easier and easier. And, you know, just try to keep it basic instead of getting completely overwhelmed. Just start to really pay attention to every single food that you decide to eat, and ask yourself, how does it serve my greater purpose? You know, how does it serve my mission? And, you know, food as close to its natural source is really what you need to be eating. So avoiding packaged processed foods is probably the first place to start. And I would also go gluten-free, but watch the gluten-free packaged foods because they typically contain a lot of crap. So when we say go gluten-free, we mean basically no bread, you know, no gluten is containing sources of anything. You could do quinoa, you could do rice, you know, those are nice, easy things to do. But, and focus on protein and fat. That's just super important. And then you can phase into the bath and beauty products. I think, you know, that's typically, Aimee, you can chime in. That's typically how I do it in my clinic, where if someone, I don't want to totally overwhelm them because I don't want to lose them. I don't want to shut them down. So I'll start with diet first, maybe a few supplements, and then we get into the bath and beauty products, and then we get into the household products and start to make that entire lifestyle shift. But
yeah, I think you're right, Aimee. And it is overwhelming. I certainly appreciate it. I think, you know, Aimee and I wanted to just get as much information to you as we could in our time together. So, you know, we don't want it to be overwhelming. But, you know, I tried to take the overwhelm out of this whole lifestyle change through, you know, the Jumpstart program that I teach. It's, you know, in 7 days, I kind of walk you through this whole process. And a big focus of it is on food and getting into the kitchen. And, you know, you can just download my recipes. They're seasonal. You get the summer recipe plan and just start cooking. Just get in the kitchen cooking and do it from a place of, you know, I think so many of us approach going on a diet, this mentality of diet deprivation and denial. That's not what this is about. This is about, I call it the 4 N's, you know, nourishing yourself, trying new foods, and being nurturing and nice to yourself. This is all about self-care. And that's really what it means to be a diva, is taking extreme self-care. So approach it from that mindset. You're loving yourself up, and it has to be from that place of self-love, because that's when you can really make changes based on, you know, this paradigm shift of giving yourself the best food available because you love yourself and you are enough. So, you know, I think to me, that's the first place to start, is that mindset. I'm going to do this because I love me and I love my future child. And, you know, I'm going to just start feeding myself the best quality foods. And just, you know, and you're right, Aimee, if you have a food, you know, 4th of July is coming up, and maybe there's like a special 4th of July that, you know, Aunt Peg makes, and it's there every year at the cookout. Well, you know what? And I say an indulgence is an opportunity to experience pure pleasure. So allow yourself 3 delicious bites, and then the law of diminishing returns kicks in, and nothing doesn't taste as good after that. And, you know, let it go, but don't deny yourself something truly pleasurable like that, or like your pizza, Aimee. So yeah, start with the food, and then it will snowball from there. You know, small hinges swing big doors.
I love it. One thing that, and we'll wrap up after this, one thing I always say too is, you know, just you shift your beliefs, and then your behaviors will shift to support those beliefs. And when your behaviors shift, then your health's going to shift. So, and the belief we're talking about here, that, you know, we're on the same page totally. I call it your self-love health mission in my book, you know, but that you adopt these changes from a place of believing in your body again, believing that you can rectify this situation, that you can heal from your PCOS, you can shift, you can feel better, you know. So to believe that you have the power to do that is so important. And then to do it from a place of, I'm worth it, I love myself, and you'll see then the changes become easier and easier. They just really do. And to me, that's a real important piece to the motherhood thing too. I really want you to, you know, as I always say, and excuse my language, have your shit figured out so you don't put it on your kid, you know. So but we can all do that. So work on loving you first, and then, you know, when you become a mother, I think the mothering thing's even easier. Okay, so I'm going to say my goodbyes, then I'll Aimee say hers, but thank you all so much, and I will be following up with an email tomorrow, and we'll give you links on how to find Aimee and all her awesome programs, and links on me. And this video will live on YouTube, and I'll include a link to the video again tomorrow so you can watch it, leave comments, share it with anyone you think who could benefit from it, and stay tuned for my next month's fertility sessions. But thank you so much, and however I can help you, please reach out and ask.
And thanks everyone for listening. You know, reach out to me, Aimee at PCOSdiva.com, and you know, I'm happy to help in any way I can.
Yay. Okay. Thank you. All right. Thank you so much, guys. You'll hear from us tomorrow on email. And if you are just finding this video on YouTube, then thank you for watching. And our info is in the box below. Thanks. Have a great night.